Okay, this video we will look at doing massage therapy techniques to the gluteal muscles, and we're going to do the work actually right through clothes, in this case shorts. So the first thing that we can start with gluteal work is a little bit of a tapotement technique. We would just do a little bit of rocking, and I'm doing a gentle push on the side of the pelvis to get a little bit of rocking, which can be quite a relaxing initial contact that you can make with your client or your patient. Because we're working through clothing, we won't be using any oil. So the next stroke that I'm going to do, and I'll just work on the one side for now, I'll do a modified effleurage. So on this effleurage, my pressure is going out towards the side of the pelvis, and I can cover various parts of the gluteals on the one side as I do that. In this case, I'm doing that form of effleurage with a bit of supported hands. So one hand is heading in the direction of the pelvis, and the other one is just putting a little bit of extra pressure over top. A modification to doing it this way would be to use a forearm for some effleurage. And again, effleurage is a stroke that can be used to acquaint the patient or the person on the table to your touch. So it's kind of a warm-up stroke in that way. Good for blood flow as well. So that's probably plenty of effleurage. The next one that I'll show is a bit of palmar kneading. And now remember, with the palmar kneading, any of the kneading strokes, we usually have a circular component to it. So in this case, I'm using one palm with a little bit of a circular pressure, and as always, there's a pressure on one part of the stroke, and then we get a little bit lighter on the other part. I'll do a little bit with my other hand as well. So a bit of a circular component to that petrissage stroke of kneading with the palms. Another modification to doing kneading in that way would be to use a loose fist. So again, working at a bit of a circular motion. This table height is not adjustable, so you probably see that my wrists won't be in perfect alignment on some of the strokes, but ideally we'd like the wrist to stay in this alignment, so I'd have to be up, have either the table height a little bit lower or be up a little higher. And again, I'm just choosing to do a bit of a reinforced kneading. You could certainly use one hand or the other to do it. Okay, so that's a modification. The next one, so kneading has a circular component, compressions does not, if you remember. So now what I'm doing is I'm using a bit of palmar compression. I'm basically following the line of the sacrum, so I'm going to be on some of the gluteal origins. And on this, I'm actually going to go all the way out to the side, and have you let me know if it's too much, okay? I'm compressing along the whole sacrum down to the coccyx. A little bit of floating fingers there, just so I'm not putting my hand too invasively right over the gluteals. And then again out to the side. A little hard to see on that side, but basically if I show it here, I'm just putting some compression in along the iliac crest. Alternately, with the modification, this is again a deeper technique, so again a loose fist, can't say that. And you can use that all the way along the gluteals into the more of the muscle bellies themselves. Here I'm just doing, as we talked about the other day, sort of the cat trotting or the cat compressing, one hand and then the other, using a loose fist. Alternately, you could use knuckles. So those would be deeper modifications compared to a palm or finger compressions. All right. The next thing then we'll show as a basic stroke is fingertip kneading. And again, because it's a kneading stroke, it has a circular component to it. And again, I'm following the sacrum down towards the lower attachments of the gluteus max, along the sacrum, and then up along the iliac crest. So again, because I'm on this side, I'll just show a few here so it's easier to see. Sorry, is that too pokey, Abby? Okay, all right. And you can follow all the way out there. As well, we can work around the greater trochanter. So usually I wouldn't work across the table, but just so that you can see what I'm doing. A little bit of fingertip kneading. I'm over the IT band now and a little bit of the anterior. This might be a bit ticklish. Some fingertip kneading, because remember there's a lot of muscles that insert around that greater trochanter. Good. Alternately, we could use knuckles, so I'll show that on this side, and we could do fingertip kneading, or pardon me, knuckle kneading with a circular component there again. As soon as you go to a bony surface like this, it's going to be quite a bit deeper. So you want to watch and feel for tissue response and kind of chat with your patient about how that feels. All right. The next thing that we'll do is we're searching for piriformis. So remember, piriformis is going to come off the anterior part of the sacrum, and it's going to slip into the big greater trochanter. So we're aiming roughly for an angle in this fashion, and we're going about midway. Trigger points on piriformis are quite common. So I'm using a fingertip bit of compression just along that muscle itself. Alternately, I can use a fist. I'm just doing compressions here. I can use my palm, which is a broader surface. So this would be a nice introductory stroke to use on piriformis. Obviously, fingertips and knuckles would be a bit deeper. The other alternative, especially when you have a lot of tension, there's not too much tension here on this person here, but alternately you can get an elbow, preferably the flatter surface, and you're going to start off with that. Try to get good body mechanics on that. And if I'm just doing ischemic compression, I'm just going to sink in within patient tolerance. Abby, 0 to 10, what sort of pressure rating would you give that?
2.
2, so very tolerable then by the sound of it. So there isn't really any notable tightness that I'm feeling, so we're just more or less showing the technique. On some people it wouldn't be unusual to get easily up to a 5 or a 7 with an elbow pressure there. I'm going to also come slowly out of that, and I'll show one more modification where we're going to take the ankle and bend the knee to about 90 degrees, and I'm going to go back to an elbow with my opposite arm now. And if piriformis is tight and or if the range is just, oh, there we go. Now we got a response. What I'm doing is I'm adding some rotation at the hip, so I'm now doing lateral rotation, which will shorten piriformis, and then medial rotation, which will lengthen it. Has it settled, Abby? Sorry about that.
I don't even know what happened.
Okay. Some part of it was reacting. It was tight there to start off with. And we can just do some passive range of motion there, or we can alternately go into medial rotation and really get a stretch on that again if it was tight. We would exit that gracefully or slowly, put the foot back down. And because that was a bit of a deeper technique, we might do a little bit of finger compressions or kneading and a bit of effleurage just to make sure that that feels a little bit better than an elbow sitting in there. And that's the gluteals.